Welcome to Learning Canadian English, Episode 51. I'm Mike.
And I'm Jen. It's great to be with you all today.
Today, we're tackling a topic that can be a little stressful for newcomers, going to a walk-in clinic.
That's right. When you're not feeling well, the last thing you want is to worry about what to say.
Exactly. I remember my first time getting a bad cold here. I had no idea where to go or what to do. I was a bit nervous about speaking to the doctor.
Me too. So today we want to make it easier for you. We'll share our experiences and teach you the essential medical phrases you need to navigate a walk-in clinic with confidence.
We want you to feel prepared and reassured. So let's get started.
First things first, Mike. Let's explain what a walk-in clinic is. It might be a new concept for some of our listeners.
Good point. In Canada, if you have a family doctor, that's usually the first person you call when you're sick. But many newcomers don't have a family doctor right away.
Exactly. And that's where a walk-in clinic is so helpful. It's a medical clinic where you can see a doctor without an appointment. You just walk in.
Right. It's for health issues that are not life-threatening emergencies. You wouldn't go for a heart attack, but you would go for things like a bad flu, a sore throat, a minor cut, or if you think you sprained your ankle.
Or if you need a prescription refilled. They are very convenient for those urgent but not emergency situations.
Right. And let's be really clear on that. If you are having chest pains, difficulty breathing, or a very serious injury, you should go to the emergency room at a hospital or call 911.
That's a critical point. A walk-in clinic is for when you feel quite sick, but your life is not in danger.
Perfect summary. So it's a step between your family doctor and the hospital emergency room. Let's give a few more examples. If you have a persistent fever that's not dangerously high, a possible ear infection, or a minor allergic reaction, a walk-in clinic is a great choice. They can also handle things like renewing a prescription that you take regularly.
Okay, so you've decided you need to go to a walk-in clinic. What should you prepare before you leave the house? That's a good point about prescriptions. But what about more serious things? For instance, if you have a cut, how do you know if it's a minor cut for a walk-in clinic or a serious injury for the emergency room?
This is so important. The number one thing you must bring is your provincial health card. In Ontario, it's called an OHIPE card. In British Columbia, it's a BC Services card. Every province and territory has one. This card shows that you have public health insurance.
And it's very important because without it, you might have to pay for the visit.
Correct. The second thing I recommend is making a list.
A list? What kind of list?
A list of any medications you are currently taking. Include the name of the medicine and the dose. Also, write down any allergies you have, especially to medication, like penicillin.
That's such a great tip. It's easy to forget those details when you're feeling sick or nervous.
Totally. And my last tip is a practical one. Be prepared to wait.
Oh yes, the waiting room. Walk-in clinics can be very busy. The wait time can be long, sometimes an hour or more. So bring a book, listen to a podcast, like this one.
Right. And make sure your phone is charged.
And one more tip before you go. It's a good idea to search for the clinic online or call them first.
Why is that?
To check their hours. Some clinics close early and some have specific times when they stop accepting new patients for the day. You don't want to travel all the way there just to find out they are full.
That has happened to me before. An excellent tip. Patience is key.
All right, you've arrived at the clinic. The first person you'll talk to is the receptionist at the front desk.
This is your first conversation, so let's make it simple. Let's practice a few key phrases.
Hello, I'd like to see a doctor.
Perfect, simple and direct. Since it's a walk-in clinic, you can also add, I don't have an appointment.
Right. The receptionist will then likely ask you for your health card and photo ID. They will also probably ask you, what is the reason for your visit, or what are your symptoms?
Symptoms are the physical or mental signs of an illness. For example, a cough is a symptom of a cold.
Exactly. So you need to be ready to briefly explain why you are there. You can say something like, I have a bad cough and a fever, or I hurt my wrist.
Keep it simple at this stage. You will give more details to the doctor.
After you give them your information, they will give you a form to fill out. This is a registration form. Then you go to the waiting room.
Okay, after waiting, a nurse will call your name and then you'll see the doctor. This is the most important conversation.
Don't be nervous. Doctors are there to help. Speak slowly and clearly. It's okay to ask them to repeat something.
Let's start with how to describe pain. The doctor might ask, where does it hurt?
Right. You can say, I have a pain in my, and then name the body part. For example, I have a pain in my back.
And you can use describing words. Is it a sharp pain, like a needle, or a dull ache, which is a more constant, low-level pain?
Those are great words. You could say, I have a sharp pain in my chest when I breathe, or I have a dull ache in my lower back.
Another useful phrase is describing the pain on a scale. The doctor might ask, on a scale of 1 to 10, with 10 being the worst pain imaginable, how bad is your pain?
And you can answer, it's about a 7. This helps them understand how serious it is.
Let's move on to cold and flu symptoms. These are very common reasons to visit a clinic.
Yes, let's list some common phrases. You can say, I have a sore throat, or I have a runny nose. That's when liquid comes out of your nose.
Or the opposite, I have a stuffy nose, which means you can't breathe easily through your nose.
I have a persistent cough, meaning a cough that doesn't stop. Or, I feel dizzy, which is when you feel like the room is spinning. And a very common one, I feel nauseous. This is the feeling that you are going to vomit.
Some other key phrases for flu-like symptoms are, I have the chills, which is when you feel cold even if it's not cold, and I have body aches.
Ah, yes, when your whole body feels sore. And what if you have a skin problem? You could say, I have a rash on my arm, or I have a strange mole I'm worried about.
Good one. Knowing the specific words really helps the doctor diagnose the problem faster. Now, what about for injuries, Jen?
If you had an accident, you can explain what happened. I fell and I think I sprained my ankle. A sprain is a common injury for joints. Or you could say, I twisted my wrist, or I have a deep cut on my hand.
The doctor will also ask you questions. A very common one is, how long have you had these symptoms? Those are all very clear. Let's talk about stomach problems. These are also very common.
And you can answer with, for about 3 days, or since yesterday.
It's also good for you to ask the doctor questions.
Yes, be an active part of your healthcare. You can ask, what do you think is wrong? Or what's the diagnosis?
You can also ask, do I need a prescription? A prescription is a doctor's written order for medicine.
And another good one, especially if you have a cough or cold, is it contagious? This means, can other people get sick from me?
Okay, so the doctor's visit is over. If the doctor gave you a piece of paper for medicine, that is your prescription. Another important question to ask is about follow-up. You can ask, do I need to come back for a follow-up visit?
That's right. You don't get the medicine at the clinic. You need to take that prescription to a pharmacy. A pharmacy is also sometimes called a drugstore. You can find them on their own or inside many grocery stores.
When you go to the pharmacy counter, you give the pharmacist a prescription and say, "I'd like to fill this prescription, please."
Fill a prescription is the specific phrase we use. The pharmacist will then prepare your medication. They will also explain how to take it. For example, take 2 pills every 8 hours. It's important to listen carefully or ask them to write it down.
And it is always a good idea to ask the pharmacist, "Are there any side effects I should know about?"
That's a great question. Side effects are the other, sometimes unwanted effects that a medicine can have. For example, some medicine might make you feel sleepy.
Exactly. It's good to be informed. It's also good to know the difference between prescription medication and over-the-counter medication. So, you've seen the doctor, you've got your medication. What happens if you don't start to feel better after a few days?
Right. Over-the-counter medicine, like for a simple headache or a cold, you can just buy off the shelf. But for stronger medicine, you need a doctor's prescription.
So, that was a lot of information, but we hope it helps you feel more prepared.
Let's do a quick recap. Remember to bring your health card, be ready to describe your symptoms clearly, and don't be afraid to ask questions.
Exactly. Navigating a new healthcare system can be challenging, but with a few key phrases, you can do it.
Everyone working in healthcare in Canada is there to help you, so take a deep breath. You've got this.
That's all the time we have for today on Learning Canadian English.
Thanks for listening. Join us next time for another episode. Goodbye for now.